Okay, so what is arm? The portion that is present between the shoulder joint till the elbow joint. Now, this portion we called it as a arm. The skeletal of the arm is solo bone, that is the humerus. So the only bone present over here in this portion that is of a humerus. Right? Now, this is a cross section. This is a cross section of the arm. We have cut the whole of the arm from its middle, and now we are looking at the structures, right? So now you try to understand this very important. Now you see at the center there is a humerus bone, right? But you see on its side there is intermuscular septa. You can see where the cursor is. This is the lateral intermuscular septa, and on this side there is a medial intermuscular septa, right? So on both the side there are muscular septa. With the help of this septum, now what we are doing, we are dividing the whole of the portion, whole of the arm into two parts. Anterior compartment, you see where the cursor is, and the posterior compartment. So see the portion present in front of these two intermuscular septum, we called it as an anterior compartment. The portion behind this intermuscular septum, we called it as a posterior compartment. The anterior compartment also called as a flexure compartment. Posterior compartment also called as a extensor compartment, right? So with the help of this intermuscular septum, now we are dividing the arm into two parts, flexure or the anterior compartment, extensor or the posterior compartment, right? Okay. The arm is called brachium, right? So in other words, the arm is called the brachium. So most of the structures in this chapter are named accordingly, like the muscle called as the brachialis, another muscle that is coracobrachialis, the artery which is running over here, brachial artery, that is extension of which artery? Anyone? Brachial artery is an extension of which artery? Anyone? कौन सी आर्टरी नीचे आके ब्रेकियल आर्टरी कही जाती है? अरे, axillary, correct. Right? So axillary artery comes downward and then it is called as a brachial artery. Brachial artery will further terminates into the radial and the ulnar artery. Right? Okay. So we have divided the whole of arm into two parts, flexure compartment and the extensor compartment. Now, first we look at the muscles in the front of the arm. So हमने दो पार्ट में डिवाइड किए थे ना, फ्रंटल और फ्लेक्सर एंड एक्सटेंसर, और एंटीरियर और पोस्टीरियर. तो पहले हम एंटीरियर कंपार्टमेंट के मसल्स को हम देख रहे हैं, ठीक है? तो यहाँ पर टोटल तीन मसल्स है. These are coracobrachialis, you can see over here. Then you can see over here biceps brachii, and the third one that is a brachialis. Coracobrachialis, biceps brachii, and brachialis. Okay, so these are the three muscles present in the front of arm. Let's take one by one. First one, that is a coracobrachialis. So this is a coracobrachialis. Now you see the origin that is over here. That is, you can say this is the bone called as a scapula, and this red portion that is called as a coracoid process. From the tip of the coracoid process, there is the origin of coracobrachialis. So coracobrachialis origin that is from the tip of coracoid process, and the fibers are going downward, and finally you see it is inserted. You can see this is the humerus. Over here there is a lateral border, there is an anterior border, and there is a medial border. So at the middle of the medial border there is an insertion of this coracobrachialis. So the origin is at the tip of coracoid process, the insertion that is at the middle of the medial border of the humerus. The nerve supply that is supplying this coracobrachialis, na, that is musculocutaneous nerve. Always remember, very important, the muscles in the front of the arm, or in the frontal compartment or the flexure compartment are supplied by this nerve, that is a musculocutaneous nerve. So you see, this is a tip of coracoid process, that is the origin site of the coracobrachialis, and it is inserted at this point, that is the middle of the medial border, while the action that is the flexion. Why? You see, the most of the muscles are are from the flexure compartment, right? So based on this, the action is also very obvious that it will be helping in the flexion. So it helps in the flexion of the arm at the shoulder joint. So that is regarding the first muscle, that is the coracobrachialis. We quickly move towards our next muscle, that is the biceps brachii. So the next muscle, that is biceps brachii. You see the bodybuilding muscle, right? Okay. The biceps brachii, you see the name is given biceps as it has a two heads. Even you can see in the diagram, in the picture, as it has a two heads, it is called as a biceps brachii, right? So there are two heads, long head and a short head. You can say this is a long head and this is a short head. The long head, the short head arises from the where the coracobrachialis arises. That is at the tip of coracoid process. मतलब के tip of coracoid process से जैसे कोरेकोब्रेकियालिस का ओरिजिन था, वैसे ही वही साइड से शॉर्ट हेड ऑफ बाइसेप्स ब्रेकाई भी ओरिजिन होता है. ठीक है. नाउ द लॉन्ग हेड arises from supraglenoid tubercle of the scapula. Now you see दिस इज ओवर हियर, देयर इज अ ग्लिनॉइड कैविटी. ठीक है. ग्लिनॉइड कैविटी के ऊपर एक ट्यूबरकल रहता है, उसको हम कहते हैं सुप्राग्लिनोइड ट्यूबरकल. उसके नीचे ये एक ट्यूबरकल रहता है जिसको हम कहते हैं इंफ्राग्लिनोइड ट्यूबरकल. तो उसका ओरिजिन कहाँ से हुआ है? फ्रॉम द सुप्राग्लिनोइड ट्यूबरकल. सो लॉन्ग हेड arises from supraglenoid tubercle, while the short head arises from the tip of coracoid process. Tip of coracoid process also on the scapula. Supraglenoid tubercle, that is also on the scapula. As you can see in this diagram, you see this short head arising from the tip of coracoid process. This is a coracoid process and this is a tip, right? And you see the long head that is arising from the supraglenoid tubercle. So that is a supraglenoid tubercle. ये जो cavity है, that is a glenoid cavity. तो उसके ऊपर रहेगा supraglenoid tubercle. So origin of two heads, short head and the long head. Short head from the tip of coracoid process and the long head that is from the supraglenoid tubercle. Similarly, the fibers move downwards and insertion that is on the posterior rough part of the radial tuberosity. Now we see what is radial tuberosity. You see this is the bone, we call it as a radius, right? तो ह्यूमरस ऊपर के साइड होता है, उसके नीचे रेडियस एंड अल्ना होता है. तो रेडियस के अंदर एक पोर्शन आता है जिससे हम कहते हैं रेडियल ट्यूबरोसिटी. इट इज द रेडियल ट्यूबरोसिटी दैट इज द साइट which offers insertion to this biceps brachii, right? Now you try to understand this, and this is very important. You see, it is inserted on the radial tuberosity and the tendon gives off an extension. मतलब कि you see, यहाँ से इसका इंसर्शन तो रेडियल ट्यूबरोसिटी पर हो गया, पर जो ये जो छोटा सा पार्ट है वो यहाँ से निकल जाएगा. And then it forms a very thin aponeurosis. You can see where the cursor is, na? And that is called as a bicipital aponeurosis, जिसे हम कहते हैं बाइसिपिटल एपोन्यूरोसिस. मतलब कि ये जो पूरी मसल थी बाइसेप्स ब्रेकाई, उसका इंसर्शन तो हो गया रेडियल ट्यूबरोसिटी पर, और छोटा सा पोर्शन यहाँ से निकल गया और वो बनाएगा बाइसिपिटल एपोन्यूरोसिस. अब ये बाइसिपिटल एपोन्यूरोसिस का क्या काम है? बाइसिपिटल एपोन्यूरोसिस का ये इंपॉर्टेंस है कि यहाँ पर दो स्ट्रक्चर बहुत ही नजदीक में से जाते हैं. एक तो ब्रेकियल आर्टरी एंड सेकंड दैट इज अ मीडियन क्यूबाइटल वेन. सो बाइसिपिटल एपोन्यूरोसिस intervenes in between the brachial artery and median cubital vein, separating both the structure. ठीक है. So that is the importance of bicipital aponeurosis. So we are learning currently regarding biceps brachii muscle. We are learning the insertion, the origin that is in the form of short head and the long head. We are currently learning the insertion that is mainly at the radial tuberosity. But a small portion forms a bicipital aponeurosis. The importance of this bicipital aponeurosis is that it separates the brachial artery with the median cubital vein. ठीक है. So again, it is a strong supinator. When the forearm is flexed, all screwing movements are done with it. It is a flexure of the elbow. The short head is a flexure of the arm. The long head prevents upward displacement of the head of humerus. Okay, this is very important. Na? There are two heads, short head and the long head. Short head, that is a flexure of the arm, but the long head prevents displacement. तो लॉन्ग हेड मेक श्योर करता है कि वो अपनी जगह पर प्रॉपरली रहे, ह्यूमरस जो है वो अपनी जगह पर प्रॉपरली रहे, उसका डिस्प्लेसमेंट ऊपर की तरफ ना हो जाए. ठीक है. तो बोथ हैव देयर ओन रोल्स, शॉर्ट हेड एज वेल एज अ लॉन्ग हेड. द नाउ सप्लाई जस्ट लाइक coracobrachialis, over here the nerve supply, that is a musculocutaneous nerve. Now comes the third muscle, that is the brachialis. Okay, so the third muscle, that is the brachialis. Okay, origin. Sorry. तो दिस इज ब्रेकियालिस. अभी आप ये समझिए कि जो कोरेको ब्रेकियालिस और बाइसेप्स ब्रेकाई जो थे, वो थोड़ी ऊपर की तरफ थे, उनका एरिया थोड़ा ऊपर की साइड था. ये जो मसल है ब्रेकियालिस, वो थोड़ा नीचे की साइड है. सो ओरिजिन, दैट इज यू सी लोअर हाफ ऑफ द फ्रंट ऑफ ह्यूमरस. ठीक है, वो दो जो मसल थे वो तो अपर अपर साइड से आ रहे थे. इसका ओरिजिन कहाँ है? लोअर हाफ ऑफ द फ्रंट ऑफ द ह्यूमरस. तो तकरीबन यहीं से उसका इंसर्ट ओरिजिन रहता है, तो यहाँ से फाइबर्स उसके नीचे की ओर जाते हैं. ठीक है. नाउ सी अगेन, यू कैन सी ओवर हियर, from the mid half of the humerus, lower side, lower portion that is covered by the brachialis and not the upper one. You see, this is a coracoid process. यहाँ से हमारे वो मसल निकल रहे थे, कोरैको ब्रेकियालिस और बाइसेप्स ब्रेकाई. उसके नीचे की और ये मसल्स है, दैट इज अ ब्रेकियालिस. ठीक है. बाइसेप्स ब्रेकाई का इंसर्शन था, वो था रेडियस पर. ब्रेकियालिस का इंसर्शन है, दैट इज ऑन द अल्ना. ठीक है. सो दीज आर द अपर हेड, अपर पोर्शन ऑफ द अल्ना. अपर पोर्शन के अंदर वेरियस साइट है, जैसे कि कोराकॉइड प्रोसेस. ठीक है. अभी आप ये समझिए, ये जो पूरा ग्रीन है, दैट इज अ ऑलेक रेनॉन प्रोसेस. ठीक है. यू कैन सी द रेड कलर, दैट इज अ कोरोनॉइड प्रोसेस. तो ये जो ब्रेकियालिस मसल है, यू कैन सी ओवर हियर, दैट इज इंसर्टेड एट दिस पोर्शन, दैट इज अ कोरोनॉइड प्रोसेस ऑफ द अल्ना. यहाँ पर भी देख सकते हैं, ये जहां पर कर्सर है, दैट इज अ कोरोनॉइड प्रोसेस. तो कोरोनॉइड प्रोसेस पर आकर ब्रेकियालिस का इंसर्शन रहेगा. ठीक है. सो द ओरिजिन, दैट इज फ्रॉम द ह्यूमरस, lower portion, from the middle to the lower portion of the humerus, and it is inserted on the coronoid process of the ulna. ठीक है. Now supply, this is slightly tricky, right? ठीक है. कोरैकोब्रेकियालिस और बाइसेप्स ब्रेकाई, दोनों को जो नर्व सप्लाई थी, दैट इज मस्क्यूलोक्यूटेनियस नर्व. बट दिस इज अ ब्रेकियालिस मसल. ओवर हियर there are double nerve supply. These are muscle which have double nerve supply in the form of musculocutaneous nerve and radial nerve. ठीक है. So again, many a times this asked in MCQ, from the muscles of the arm, this is the only muscle which has double nerve supply, one from the radial nerve as well as another from the musculocutaneous nerve. Again, as it is from the flexure compartment, the action helps in flexes the forearm at the elbow joint. ठीक है. So that is of a brachialis. You see, both are muscles. Brachialis as well as the biceps brachii helps in the flexion at the elbow joint. Huh? You see, the prominent one, that is biceps brachii, but the more stronger, that is the brachialis. Okay, brachialis is more stronger than the biceps brachii. Right. So these are the muscles from the front compartment of the arm. We have covered coracobrachialis, followed by the biceps brachii and the brachialis. All have their action in the flexion, right? Out of this, now the coracobrachialis as well as the biceps brachii were having the nerve supply from the musculocutaneous nerve, while the brachialis is having nerve supply from both musculocutaneous nerve as well as the radial nerve. Now we are going to the muscles from the posterior compartment. ठीक है. जो वो lateral और medial intermuscular septum थे, that was dividing the portion of the arm into two parts, ना, flexor and the extensor, or you can say anterior and the posterior. तो एंटीरियर तो हो गए, उसमें तीन मसल्स आते हैं, कोरेकोब्रेकियालिस, बाइसेप्स ब्रेकाई एंड ब्रेकियोब्रेकियालिस। पर अब आता है पोस्टीरियर कंपार्टमेंट। सो नाउ वी आर लर्निंग द पोस्टीरियर कंपार्टमेंट। पोस्टीरियर कंपार्टमेंट हैज अ सिंगल मसल, दैट इज अ ट्राइसेप्स ब्रेकाई। अगेन, एंटीरियर कंपार्टमेंट जो था, वहां पे तीन मसल थी, कोरेकोब्रेकियालिस, बाइसेप्स ब्रेकाई एंड द ब्रेकियालिस। पर ये जो पोस्टीरियर कंपार्टमेंट है, वहां पर एक ही मसल है, द सिंगल मसल इज दैट, एंड दैट इज अ ट्राइसेप्स ब्रेकाई। जैसे कि बाइसेप्स ब्रेकाई में हमने देखा था ना कि उसके दो हेड रहते हैं, तो ट्राइसेप्स ब्रेकाई के तीन हेड रहते हैं। उसे हम कहते हैं लॉन्ग हेड, लेटरल हेड एंड द मीडियल हेड। ठीक है, तो द फर्स्ट वन है दैट इज अ लॉन्ग हेड, दैट इज अराइजिंग फ्रॉम द इंफ्राग्लिनोइड ट्यूबरकल ऑफ द स्केपुला। जैसे स्केपुला के ऊपर सुप्राग्लिनोइड ट्यूबरकल था, वहां से कौन सी हेड आ रही थी? लॉन्ग हेड ऑफ बाइसेप्स ब्रेकाई। तो इंफ्राग्लिनोइड ट्यूबरकल है, वहां से क्या ओरिजिन हो रहा है? लॉन्ग हेड ऑफ ट्राइसेप्स ब्रेकाई। ठीक है, सो द लॉन्ग हेड ऑफ ट्राइसेप्स ब्रेकाई दैट इज ओरिजिन फ्रॉम द इंफ्राग्लिनोइड ट्यूबरकल। लेटरल हेड, that is arising from the posterior surface of the humerus. And the third one, that is the medial head. You can see the whole triangular area. Can you see where the cursor is? That is the medial head, right? तो ट्राइसेप्स ब्रेकाई के तीन हेड है, लेटरल, लॉन्ग, लेटरल एंड मीडियल। लॉन्ग जो है that is from infraglenoid tubercle. Lateral head, that is upper portion of the posterior surface. This is medial head, that is from the larger triangular area on the posterior surface. So यहाँ से देख ही सकते हैं, ये जो है that is a medial head arises. Over here there is a lateral head arises. So that is from the triceps brachii. Now the insertion. Now try to understand this. हाँ, long head, तीन head है, long head, lateral head and the medial head. Out of this ना, the long and the lateral head converge and fuse to form a superficial flattened tendon which covers the radial nerve and it is inserted in the radial groove. तो आप ये समझिए कि लॉन्ग हेड एंड लेटरल हेड वो दोनों इकट्ठी हो जाएगी एंड देन इट विल फ्यूज। पर ये जो मीडियल हेड है, that is inserted in the posterior part of the superior surface of the olecranon process. You see, this is the olecranon process where the cursor is. तो वहां पर इंसर्शन होगा मीडियल हेड का। तो आप ये समझिए कि तीन हेड है, लॉन्ग हेड, लेटरल हेड एंड द मीडियल हेड। लॉन्ग हेड और लेटरल हेड कौन एक दूसरे के साथ मिल जाएंगी और वो इंसर्ट करेंगी रेडियल ग्रूव में। पर मीडियल हेड है that is inserted in the posterior portion of the olecranon process. So that is regarding the triceps brachii. It is having three heads. Okay. Now you try to understand nerve supply. Each head receives a separate branch from the radial nerve, right? So always remember, na, muscles in the posterior compartment are supplied by the radial nerve. Anterior compartment, three muscles, all of them were supplied by the musculocutaneous nerve. Additionally, brachialis was also supplied by the radial nerve. तो मतलब एक ही मसल ऐसी है फ्रॉम द होल ऑफ आर्म विच हैज डबल नर्व सप्लाई, दैट इज अ ब्रेकियालिस। ठीक है, ट्राइसेप्स ब्रेकाई अगेन गेटिंग नर्व सप्लाई फ्रॉम द रेडियल नर्व। The triceps is a powerful active extensor of the elbow. You see, most of the muscles are helping in flexion in the front of the arm. This is the muscle from the posterior compartment helping in the extension, right? So that is of a triceps brachii helping in the extension. So these are the muscles from the arm, right? Anterior compartment as well as the posterior compartment. Just a minute. ठीक है, okay, we move further. Any doubts till now? ठीक है, we move further towards our next topic. Just a minute. Are you able to see my screen? Are my slides are changing? स्लाइड्स चेंज हो रही है ना?
No, sir.
Now is it changing?
Yes, sir. Thank you.
Okay, okay,
Yes, sir.
okay. Tabi, the next topic that is related to these muscles only, and that's why we are taking it because it is a cubital fossa, right? So it's a triangular hollow area situated in the front of the elbow. So that is of a cubital fossa. ठीक है? जैसे कि पाव में at the back of the knee there is a popliteal fossa. The front of the elbow has a cubital fossa. ठीक है? Cubital fossa. Okay. Now you see this is a lateral side. Lateral means where our thumb is. Medial means where our little finger is. ठीक है? तो you try to understand this ना. Laterally it is bounded by the brachioradialis. Medial it is bounded by the pronator teres. तो ये जो हॉलो एरिया है, ये जो ट्रायंगल बन रहा है ना, दैट इज अवर क्यूबाइटल फोसा। तब ये समझिए कि लेटरली उसके है ब्रेकियोरेडियालिस, मीडियली उसके है प्रोनेटर टेरिस। पर ब्रेकियोरेडियालिस की भी दो बॉर्डर है, एक मीडियल बॉर्डर और एक लेटरल बॉर्डर। तो cubital fossa is bounded by the medial border of brachioradialis. So laterally, it is bounded by medial border of brachioradialis. Medially, it is bounded by lateral border of pronator teres, क्योंकि ये हो गया pronator teres, तो उसकी ये रहेगी medial border और ये रहेगी lateral border। तो cubital fossa को तो कौन बाउंड कर रही है? That is the lateral border of pronator teres, medial border of brachioradialis. So laterally, cubital fossa is bounded by medial border of brachioradialis. Medial it is bounded by lateral border of pronator teres. Okay. Now the base, a triangle, a typical triangle must have a base and a apex. So अभी क्या हो गया? प्रॉब्लम यह है कि यहाँ पर एक मसल है, यहाँ पर एक मसल है, पर बेस फॉर्म करने के लिए कोई मसल या कुछ स्ट्रक्चर नहीं है। तो हमने क्या कर दिया, यहाँ पर एक इमेजिनरी लाइन ड्रॉ कर दी। तो दैट वो हो गई हमारी बेस। सो द बेस दैट इज फॉर्म बाय इमेजिनरी लाइन joining the two condyles of the humerus, and the apex that is lying downward where two muscles that is a pronator teres and the brachioradialis meets with each other। तो वो हो गई हमारी अपेक्स। ठीक है? तो दैट इज द borders, base and the apex, right? Now you try to understand this ना। रूफ, रूफ हम किसको बोलते हैं? घर की जो छत होती है उसको हम बोलेंगे रूफ। तो मतलब the first structure, if we look the house from the top, the first structure that we are able to see, that is the roof. In other words, it indicates that the roof is the most superficial, right? And the structure which is at the deepest level, that is called as a floor। जो सबसे नीचे है वो हम बताएंगे फ्लोर। तो उसको हम फ्लोर कहेंगे। ठीक है? नाउ फॉर एग्जांपल this strawberry cake, so the strawberries are at the roof, the cream is at the floor। For example this na, so the topmost sandwich, that is the roof, in between there is all contents, and at the bottom we have a floor, or you can say the plate forms the floor। ठीक है? तो हम जब क्यूबाइटल फोसा को डिसेक्ट करेंगे तो सबसे ऊपर से हम देखेंगे तो सबसे पहला स्ट्रक्चर जो हमें दिखाई देगा ना, दैट इज द स्किन। फॉलोड बाय, अगर पहला लेयर है स्किन, हमने स्किन को डिसेक्ट किया तो हमको दिखाई दिए देगा सुपरफिशियल फेशिया। सुपरफिशियल फेशिया को भी हमने डिसेक्ट किया, देन विल बी एबल टू सी द डीप फेशिया। अगर डीप फेशिया भी हमने डिसेक्ट किया तो हमको दिखेगा बाइसिपिटल एपोन्यूरोसिस। ठीक है? तो पर इसमें एमसीक्यू क्या आता है? यूजुअली जो एमसीक्यू आता है दैट इज, हमने स्किन को निकाला ना, तो जो सेकंड लेयर है दैट इज द सुपरफिशियल फेशिया, एंड दैट इज वेरी इंपॉर्टेंट फॉर क्यूबाइटल फोसा। जैसे ही हमने स्किन को निकाला ना, हमने सुपरफिशियल फेशिया को देखा, तो वहां पर हमको बहुत सारी स्ट्रक्चर्स दिखाई देती है। ठीक है, द सुपरफिशियल फेशिया कंटेन द मीडियन क्यूबाइटल वेन joining the cephalic vein and the basilic vein. Okay, now you try to understand ना। You see, this is one vein where the cursor is, उसे हम कहते हैं basilic vein। दूसरी साइड पर है अनदर वेन, दैट इज अ सिफेलिक वेन। तो ये हो गई सिफेलिक वेन, ये हो गई बेसिलिक वेन। बेसिलिक वेन और सिफेलिक वेन दोनों को एक वेन है जो ज्वाइन करती है, एंड दैट इज द मीडियन क्यूबाइटल वेन। डियर फ्रेंड्स, इज वेरी वेरी इंपॉर्टेंट। मीडियन क्यूबाइटल वेन, मीडियन क्यूबाइटल वेन कनेक्ट्स बेसिलिक वेन विद द सिफेलिक वेन। ठीक है, और एक चीज, ये जो सिफेलिक वेन है ना, that is running along with one nerve that is called the lateral cutaneous nerve of forearm. Similarly, basilic vein है, वो भी एक nerve के साथ रन कर रही है, that is the medial cutaneous nerve of forearm. So again, this can be asked in MCQ, that the lateral cutaneous nerve of forearm runs parallelly with the cephalic vein, while the medial cutaneous nerve of forearm runs parallelly with the basilic vein. बेसिलिक वेन और सिफलिक वेन दोनों को क्या कनेक्ट करती है? मीडियन क्यूबाइटल वेन। एंड व्हाई दिस मीडियन क्यूबाइटल वेन इज वेरी इंपॉर्टेंट? बिकॉज इट इज द साइट टू गिव द इंट्रावीनस इंजेक्शन। जो हमारे आईवी इंजेक्शन है, दैट इज गिवन एट दिस मीडियन क्यूबाइटल वेन। Sorry. So followed by the superficial fascia, you will be able to see the deep fascia and the bicipital aponeurosis. Now you remember bicipital aponeurosis, जो हमारी बाइसेप्स ब्रेकाई मसल थी ना, उसका इंसर्शन रहता था रेडियल ट्यूबरोसिटी पर छोटा सा पोर्शन था, वो निकल जाता था और फॉर्म करता था बाइसिपिटल एपोन्यूरोसिस। तो ये वही बाइसिपिटल एपोन्यूरोसिस है। ओके, नाउ फ्लोर। अगर हम सब कुछ निकाल देंगे ना, रूफ भी निकाल देंगे, कंटेंट्स भी निकाल देंगे, तो सबसे नीचे की ओर जो हम देखेंगे ना स्ट्रक्चर, दैट इज द फ्लोर, राइट? सो द फ्लोर इज मेड अप ऑफ टू मसल, मेनली क्यूबाइटल फोसा। ये इतना जो एरिया है दैट इज क्यूबाइटल फोसा। मेनली इट इज formed by the brachialis muscle, but a small portion that is also formed by the supinator. So two muscles forms the floor, brachialis and the supinator. If you remember, laterally it was bounded by brachioradialis, medially it was bounded by pronator teres, right? And now to another muscles forming the floor, brachialis and the supinator. Contents. Very, very, very important. Always remember, na? You see, this is the medial side, this is the lateral side. When you go from medial to lateral, the structures are aligned in the form of MBBR. Very, very important. The most medially, you will find median nerve, followed by it, the brachial artery. Actually, it is a cubital fossa. Within the cubital fossa, this brachial artery terminates into two parts, radial artery and the ulnar artery। ठीक है, तो ब्रेकियल आर्टरी टर्मिनेट्स इनटू रेडियल आर्टरी एंड द अल्नर आर्टरी। उसके भी लेटरली जाएंगे तो हमको दिखेगा बाइसेप्स ब्रेकाई, टेंडन ऑफ बाइसेप्स ब्रेकाई। एंड लास्टली you can see where the cursor is, that is the radial nerve. So these are the structure present in the cubital fossa: MBBR, median nerve, brachial artery, biceps brachii and the radial nerve. Okay. So these are the structures MBBR, right? Now clinical anatomy related to it. You see the median cuboidal vein that was connecting the basilic vein with the cephalic vein, na? That is the median cuboidal vein. Why it is very important? Because it is the vein of choice for the intravenous injection. Another thing, na, why cuboidal fossa is important? Because the blood pressure is ausculted exactly at the brachial artery at this side, that is of the cubital fossa. And lastly, the clinical anatomy. The anatomy of cubital fossa is of importance because you see, while dealing with the fracture of supracondylar fracture of the humerus, you can see over here the supracondylar fracture of the humerus. ठीक है, तो वो वही एरिया में लोकेट हो रहा है जहां पर क्यूबाइटल फोसा है। तो सुप्राकॉन्डाइलर फ्रैक्चर को डील करना है तो क्यूबाइटल फोसा की एनाटॉमी आनी इम्पोर्टेंट है, right? So that is regarding the cubital fossa. You need to remember the boundaries, the lateral border, the medial border. ठीक है, the contents are very important. MBBR from medial to lateral, median nerve, then brachial artery, biceps brachii, and the radial nerve. ठीक है, and you remember the structures in the superficial fascia. There were basilic vein, there was a cephalic vein. Cephalic vein was accompanied by the lateral cutaneous nerve of forearm. Basilic vein was accompanied by the medial cutaneous nerve of forearm. Cephalic vein and the basilic vein are connected by the median cubital vein, right? So that is of the cubital fossa, right? Very, very important. Okay. Now help me solving these MCQs.
The brachioradialis.
Brachioradialis, right? Correct. Lateral boundary was formed by the brachioradialis. Medial it was bounded by the pronator teres. सुपाइनेटर कहाँ पर था? सुपाइनेटर का क्या रोल है? Anyone? Anyone? If you remember, the two muscles were forming the floor, brachialis and the supinator. So now try to solve this.
Sir, option B.
Option B. You see, it is reverse, right? It is not correct. Dr. Nista says B. Okay. So it is not medial to lateral, but it is opposite, laterally to medially. Right? So the structures medially to laterally are MBBR. So from lateral to medial, we can remember like RBBM, right? But R is removed. So the first structure is biceps tendon, followed by brachial artery, and the third one that is the median now. So correct answer is option B. इसका क्या आंसर रहेगा? Anyone? Deepest in the cubital fossa.
Brachialis.
Huh?
Brachialis, C option.
C, correct. Brachialis. Why it was forming the floor, na? That is why. The roof of the cubital fossa contains all except. अरे this is very simple. Superficial fascia में क्या क्या था? Anyone? Okay, option D. Okay. Superficial fascia has all things, huh? Median cubital vein, medial cutaneous nerve of forearm, lateral cutaneous nerve of forearm, but it was not having the radial nerve. So the correct answer is option D. Like कुछ confusion है आपको? नहीं पता चला है? Any doubts?
No.
Okay. Which structure separates median cuboidal vein from the brachial artery? This is very simple. The both were separated by bicipital aponeurosis. Venipuncture is commonly performed in correct median cubital vein. The long head of biceps brachii arises from, if you remember, there are two heads, long head and the short head. Short head was arising from tip of coracoid process, but the long head supraglenoid tubercle, correct. The long head was
Supraglenoid.
correct. So the long head was arising from supraglenoid tubercle. Which muscle is known as a workhorse flexure of the elbow? This not yet done, but this very, very important. Na? Workhorse. Okay. So the answer is brachialis. Why? The brachialis is called as a workhorse of elbow flexion because it is the most powerful and most consistently active muscles for bending the elbow. Whenever you flex your forearm, whether your palm is facing up, down, or sideways, the brachialis continues to work efficiently. So that is why it is known as the workhorse of the elbow. Which muscles inserts into the radial tuberosity? The answer is biceps brachii.
Okay.
Correct. Which muscle of the arm is attached to the coracoid process and medial shaft of the humerus? मतलब origin किसका coracoid process पर है और insertion medial shaft of the humerus है. You remember the first muscle that we learned, that was the coracobrachialis. Right, so the answer is coracobrachialis. Which muscle receives dual innervation from musculocutaneous and the radial nerve?
Brachialis.
Brachialis, correct.
Brachialis.
A fracture of the surgical neck of the humerus causes paralysis of biceps brachii. Which nerve is most likely additionally injured proximally in the axilla? इसी बाइसेप्स ब्रेकाई के बहुत ही नजदीक से जाती है मस्कुलोक्यूटेनियस नर्व. So the answer is musculocutaneous nerve. Biceps brachii,
Muscular.
brachialis, and the coracobrachialis are all supplied by the musculocutaneous nerve, which arises from the lateral cord of the brachial plexus and pierces the coracobrachialis before supplying the anterior compartment of the arm. And that is why, if biceps brachii is injured, pal is paralyzed, then surely musculocutaneous nerve going to be likely to be injured, right? So that's it from the today's session, right? We have tried to cover the muscles of the arm as well as one very important topic, that is of a cubital fossa. You can ask me if you have still any doubt in this topic, or you want to ask me anything. संदीप जी आप सुन रहे हो?
यस सर.
आप एक्टिव नहीं थे इस बार, बाकी हर बार, और इस बार तो एमसीक्यूज भी काफी इजी थे, पर आप
सर
इतने
मैं क्लिनिक पे हूँ इस टाइम, तो मैं म्यूट कर रखा था सर. मैं
अच्छा
सुन
अच्छा
क्लास.
अच्छा. ठीक है, बाकी पता चला ना, ये टॉपिक में कोई डाउट नहीं है ना?
सर मैं रिकॉर्डिंग देखूंगा. मैंने जस्ट लास्ट में ओपन किया अभी जस्ट.
ओके ठीक है, ठीक, कोई दिक्कत नहीं.
थैंक यू सर. थैंक यू.
ओके चलो. ओके.
Thank